This report is authorised by Associate Professor Maria Rossetti, Course Coordinator of MKG222 Marketing of Social Causes at the University of the Sunshine Coast. This presentation highlights the importance of a social cause, unhealthy eating in high school students, and provides an insight into the social cause by exploring sources of literature and drawing key points from that. An intervention plan is then created for the social cause and will identify the intervention's aims, potential partners and stakeholders, the strategy, price strategy, place strategy, promotion strategy, and the creative strategy and media planning. Followed by that will be an evaluation strategy, then include an ethical consideration and any potential unintended consequences. According to the Australian Institute of Health and Welfare, 1 in 4 Australian children are obese. That's 25%. Sadly, obesity, and more specifically unhealthy eating, can also have huge effects on a child's social life and experiences. A study shows amongst children in general, 17 to 30% have experienced teasing or some form of social rejection. As young adolescents grow more and more independent every day, they are able to start making choices in regards to what food they will consume, and more specifically, what food they will consume while at school. To prevent today's youth from a future of obesity and the many consequences that come along with it, there needs to be a change in behaviour. The suggested behaviour change is to establish a new habit amongst high school age children, which is to make 2 out of 5 school lunches healthy, whether that be packing their own healthy lunch or picking a healthy option at the tuck shop. Through researching over 20 credible documents, we were able to identify key themes that really came to life amongst the literature. An outstanding theme was the influence both peers and families have on one's food choices. Research showed that 50% of teens aged 14 to 17 said their families influenced their eating choices, and it was found that 20% of the teens were influenced by their peers. A huge 43% of those teens then agreed that support from friends was important to adopt healthy eating habits. Supporting that argument, another research found that parental influences and peer influences were a significant predictor to unhealthy eating behaviors among adolescents aged 16 and above. And a similar research on university students found that support from family and friends can affect students' eating behaviors. A similar research found through interviews with parents that the home environment is an important setting in regards to developing healthy eating. An interesting finding was the fact that peers associated unhealthy eating peers as fat and assigned negative characteristics to them, opposed to healthy eating peers who had positive affiliations. Clearly, these studies show a repetitive theme. However, the use of social cognitive theory would have been useful to identify gaps such as environmental factors, like norms in the community, or behavioral factors such as self-efficiency, and lastly, cognitive factors to identify their attitudes, expectations, or prior knowledge. A more hands-on research found that public recognition of making healthy eating choices can affect a child's behaviour towards an unhealthy eating choice. An Australian study showed that 16% of a child's energy intake would be consumed at school, expressing the importance to make school lunches healthy. With limited research available in Australia, it makes it hard to compare 2 entirely different countries with different views and instructions towards unhealthy eating in school-aged children. A well-justified study was conducted where they applied the socio-ecological model to target specific similarities and change health outcomes in the school environment. They found students' interpersonal factors and an individual's social environment had a greater association with the dietary choices students made for lunch than students' intrapersonal characteristics. The study also proved schools' organisational factors such as rules and policies had a greater association with whether students ate unhealthy foods. Not surprisingly, a few research documents identified that the appeal of a food influenced students' food choices. To make this literature more defined, the social ecological model could have been applied to answer questions such as, did the school's social environment affect children's appeal choices? Perhaps one of the schools is from a higher income location and the other lower income. Does the individuals themselves affect their food appeal choices? For example, cultural views, religious views, height, weight, gender, ethnicity, and so on. And did policies of the school or legislation in the area affect the food appeal choices? The same document that supported peers influencing eating choices at schools also found that time and convenience significantly impacted university students' food choices, and also how the cost of food influenced what students would eat. Constructed from the key themes identified, we were able to construct a conceptual framework which identifies key variables that drive unhealthy eating choices in teens and relates to 2 social marketing theories, social cognitive theory and the social ecological model. The intervention being discussed today is Intervention 2. The findings have led to a clear target market, which are adolescents aged 12 to 19 who are attending school. The unhealthy eating choices made at school, which is contributing to the rise of obesity in adolescents, is a serious social cause. Unhealthy eating choices made at school can lead to serious health problems in the future, both physically and mentally. This social cause needs to be appropriately addressed and focused on the behavioural change needed to reduce unhealthy eating among school-aged children. The proposed interventions suggested to change the behaviour of unhealthy eating choices made at school by school-aged children, aged 12 to 19, and establish a new habit, which is making 2 in every 5 school lunches a healthy choice, is to make healthy food choices easily accessible at school tuck shops and to be visually appealing. The literature provided proves our target market base their food choices on the visual appeal and convenience. Therefore, the intervention aims to create a healthy food option which is visually appealing in terms of the food inside and the packaging on the outside. The food will be ready to grab off the shelf, and all that would be required is to peel off the lid and enjoy. Having a healthy option which is both visually appealing and convenient will encourage the target market to make a healthy choice and work towards that new habit, which is making 2 in every 5 school lunches a healthy choice. Anderson and Getz described a stakeholder as any group or individual who can affect or is affected by the achievement of objectives. There are primary stakeholders and secondary stakeholders. Primary stakeholders are those who have a direct stake, either positively or negatively, and secondary stakeholders are those who are indirectly impacted by the objectives. Primary stakeholders for this intervention include students, academic staff, tuck shop staff, and alternative food suppliers. Secondary stakeholders include parents, suppliers, neighbours, / the local community, local interest groups, former students, and future students. Potential partners include Healthy Kids Association, Queensland Government, Nutrition Australia, local supermarkets, and the Heart Foundation. Local community groups will be of high preference as including the local community can engage the target audience and allow the target market to be more receptive to the change. Local community groups included will be the local council, local sporting clubs, and local small businesses. Each potential partner either offers support, knowledge, funding, or positive social affiliations which will benefit the effectiveness of this intervention. The product can be identified as the social cause, which has been heavily focused on throughout this video, which is unhealthy eating choices among school-aged children. There are 3 layers which compose the product. They are known as the core, the actual, and the augmented. In relation to the product, the core layer refers to the establishment of the new habit, which is increasing healthy food choices at school by adding easily accessible and healthy options to school tuck shops, which are visually appealing and evidently encourage school students to make 2 in 5 school lunches a healthy choice. The actual product will include the desired behaviour and state the specific terms needed to actually achieve it. The described behaviour is to encourage school-aged students to make 2 out of 5 lunches at school a healthy choice. This will be achieved by making healthy food choices easily available for students and visually appealing at the tuck shops. Lastly is the augmented layer, which refers to tangible objects and services which help perform the desired behaviour. So that would be the tuck shop staff preparing the specialised healthy options as well as the students who physically buy the product and are involved in the augmented product as they work towards the desired behaviour. The proposed intervention does oppose cost to the target audience. However, in these situations, students who are purchasing food from the tuck shop had intentions of spending their money in that vicinity regardless of whether it be the healthy choice or not. The healthy options will have a competitive price in order to combat students who have the mindset that healthy food is more expensive than junk food. The Australian government will provide funding to schools so as the schools are not out of pocket and can put a budget towards creating the fresh, healthy tuck shop options. The place in which the intervention will be carried out is Queensland high schools. The reason being that this intervention is currently only to be trialled in Queensland and our target audience only focuses on high school age students aged 12 to 19. A guide with recipes and instructions will be given to each high school tuck shop to make the intervention easy for everyone. Included within the guide will be the packaging in which the food should be packed in, along with the dietary label. A hotline will be available from 7 a.m. to 2 p.m. Monday to Friday for any inquiries staff may have. According to the Census social media report, the most used social media site is Facebook, and we use it the most in the evening or first thing in the morning. Our target audience has been recorded to have the highest amount of social media presence. Clearly, this intervention will be advertised through Facebook on popular pages such as the Queensland Government, the Heart Foundation, and it will appear as advertisements on popular celebrity pages and, of course, all Queensland High School Facebook pages. The advertisements will be shown at peak times between 6 a.m. to 9 p.m. and 3 p.m. to 7 p.m. Each high school will be given 6 A5 size posters to display around their school grounds. The posters aim to make students aware of the new healthy choices available and show visually appealing pictures to encourage them to purchase the product. The poster will also state encouraging words towards healthy eating. In terms of creative strategy, the desired behavior change will be achieved through providing students with visually appealing healthy food options, which are also convenient and competitive. To assist in encouraging students, Facebook advertisements will be launched on popular pages stating that the new healthy options are now available at all Queensland high schools. The posters provided by the government should be placed around the school and specifically at eating areas and the tuck shop itself to spread awareness of the new healthy options available and to help spark an interest among the students. It will also be asked that academic staff encourage students to buy the healthier options rather than unhealthy and simply remind the students that the healthy options are there. However, because the targeting is such a high-risk group, emails or letters will be sent out to the parents to inform them of the new changes and the benefits. In this circumstance, evaluating the effectiveness of the intervention will involve gaining feedback from students and teachers. Quantitative data will be collected through analysing the tuck shop sale record and reviewing the amount of healthy eating options purchased. After 6 months of the implementation stage, a statewide survey will be conducted, where we'll be able to indicate what the students like about the healthy options or provide us with knowledge on what could be done better. One staff representative from each high school will be asked to attend a meeting/workshop where opinions will be shared, statistics are measured, and new ideas are created to better the effectiveness of the intervention. This intervention will be implemented over the course of 3 years, and every 6 months, new surveys will be released, and each staff representative will attend their meeting/workshop. These strategies will identify if the time and money invested into the intervention are worthwhile and effective, or if a new course of action is required. This particular intervention involves children, which means the approach needs to be more sensitive than usual. Before implementing this intervention, certain ethical considerations have been implemented to prevent any type of harm to the children. We made sure the intervention would extend knowledge and potentially have influence on policies and practices at the schools. It considers other methods that could have had the same effect, and if the research will be of benefit to the individual child participant or children as a wider social group. Graham 2013 stated that harm to children in the form of reprisal or retribution may come from within the households as a consequence of children being included in interventions and any associated benefits. This raises the issue of how to best include or inform parents in ways that enable them to support their children and understand the importance of them being involved in the research. It was also identified that the intervention could possibly bring about stigmatism about individual children. For example, the intervention may affect an overweight child's social status. To overcome any retaliation from parents, a personalized letter explaining the intervention and positive outcomes will be sent to each parent and caregiver. Should this issue arise, the principal and the designated staff member, who is the same staff member who will be at the government-hosted meetings every 6 months, will welcome concerned parents to a one-on-one meeting. The issue of stigmatism arising from the intervention is at a very low risk. The intervention does not target any one individual and should not affect a child's social status or cause any negative interruption. If this issue were to arise, the situation would be analysed and pinpointed back to exactly where the stigmatism began, and then a change of direction will be done in accordance. This intervention isn't going to make substantial changes overnight. However, in the long run, having healthy options at high school as a normal thing could seriously impact the way students think about food for now and in the future. Investigated throughout this report was the social cause, unhealthy eating among school-aged children. Different literature identified the following key themes: peer and parental influences on a student's food choice, visual appeal affected a child's choice of food, and that the cost and convenience significantly impacts a teenager's food choice. A conceptual framework was included and gave a clear insight on relative theories in comparison to the intervention. In saying that an intervention was established to change the behavior of the social cause, the intervention was to establish a new habit of making 2 in 5 school lunches a healthy choice, and in accordance with the literature, it was found that having a healthy option, which is both visually appealing and convenient, will encourage the target market to make a healthy choice. Potential partners were established on what they could offer to the intervention in terms of support, knowledge, funding, and positive social affiliations. This intervention comes to no cost to consumers and will be funded by the Queensland Government. The promotion strategy was identified, as well as the creative strategy and media planning. Ethical considerations were outlined and justified, followed by an evaluation strategy for the future.